The gallbladder is a hollow, pear-shaped gastrointestinal organ located just below the liver at the upper right hypochondriac region of the abdomen. The primary function of the gallbladder is to collect, store and concentrate a yellow-brown digestive fluid produced in the liver called bile. Once food enters the stomach, a hormone, cholecystectomy, instructs the gallbladder to release bile into the small intestine through a common bile duct to affect digestion. The bile is important for the digestion of fats in food, and it also helps to drain biological impurities from the liver. Abnormal levels of bilirubin and cholesterol can cause the formation of hard stony masses in the gallbladder. These masses are called gallstones. They are numerous, crystal deposits that increase in size and sometimes block the bile ducts. Upon blockage, the supply of bile to the small intestine is reduced, and fat digestion is impaired, causing painful sensations in the abdomen. Common risk factors associated with bladder stone formation include sedentary lifestyle, uncontrolled diabetes, ethnicity, oral contraceptives, gender. Females are at more risk than males. Aging. Bacterial infections. Symptoms of gallstone formation include persistent upper abdominal pain, jaundice, burning sensation around the upper abdomen, bloating. Besides some simple physical examination, a maneuver called Murphy's sign will also be performed. The physician will carefully press the gallbladder to determine if it is painful. If painful, then gallstones might be present. The method of endoscopic retrograde cholangiopancreatography is the definitive diagnosis. The physician passes a small camera down the gastrointestinal tract through the mouth into the small intestine. A thin tube is introduced into the bile duct and a contrast dye is injected into the bile duct. This dye enables an X-ray machine to produce an image of the duct and determine the presence of gallstones. In this procedure, the stones can be removed in mild cases of the condition. A tiny incision is made near the umbilical margin, and a tiny camera mounted on a specialized instrument is inserted through this incision into the abdomen. This camera allows the surgeon to view the gallbladder and other organs in the abdomen. Other incisions are made by the surgeon to allow the insertion of surgical instruments into the abdomen. With these instruments, the gallbladder is separated from the liver and removed from the abdominal cavity. Using a probe, stones formed in the gallbladder are removed. The procedure is followed on a screen. The surgeon makes a 6-inch incision just below the right rib cage to access the abdomen. The abdominal organs are separated from the gallbladder with care to avoid damage to the liver. The gallbladder is removed, and the stones are extracted. This method is the most common surgical procedure available in most hospitals today. Symptoms of gallstone formation subside after the surgical procedures are performed. In laparoscopic cholecystectomy, the patient can fully recover within a week. In open cholecystectomy, full recovery might take about 5 weeks. The chances of effectively treating gallstones formation is increased when symptoms are detected early.